The next question I have for you is, what can you tell us about robotic bariatric surgeries?
So robotic surgery was born a long time ago. It's not new, but robotic surgery came to be actually out of the military. The hope was that if a soldier was injured in the field, a robot could come and assess and treat that individual, that patient, that soldier, with the operating surgeon being thousands of miles away to keep the surgeon safe and out of harm's way. The problem became that there was a time delay. When the surgeon is sitting in Germany and the patient is in Iraq, it takes a few seconds for the signal to get there. And so when you as a surgeon see blood, that's a few seconds old, and now it takes a few seconds for you to respond. And now whatever you were doing is actually 10 seconds too late. And so robotic surgery came into modern medicine. Initially, robots were really reserved for the urologists and the gynecologists. And that has changed dramatically. Robots have gone into general surgery and now into bariatrics. And so if you look at robotic adoption within bariatric surgery, nationally, about 16% of bariatric operations are done robotically. The lion's share is still laparoscopic, still minimally invasive, but there is a growing number of robotic surgeons, and that's actually one of our specialties. We love to not just do robotic surgery, but we actually teach robotic surgery as well. And I think that the future in bariatrics does involve a robot. If you think about the way we have learned to communicate with others, it used to be that you would pick up the phone off the wall and you had a direct electronic connection to the individual on the other side of the phone. Now we have a computer between ourselves and another individual. Just like you and I are talking now, there's a computer between us. And that computer is integrating some degree of computation, artificial intelligence to make this conversation happen. And the robot is no different. So the robot is using protocols and algorithms and software to make surgery safer and more effective.
So those would be the advantages. It is safer, and is it more?
So I can give you an example. I actually have a robotic instrument here. This is a robotic instrument that we would use, and you may be able to see the tip of this is a needle driver. The needle driver is open, and so I would grab a needle and suture, say, the bowel or blood vessel with this needle driver. This needle driver has a wrist. So now you see that that wrist can bend. It can bend in all directions. Imagine that we were tying our shoes and someone asked you to tie your shoes with a wrist brace. You could tie your shoes. Now, could you get the loops nice and even? Would it be easy? Probably not. But now you take off that wrist brace and you have wrists. So now you can do more precise surgery. You can get angles, you can go around turns, and you can accomplish the operation with greater precision. Now, does that greater precision translate to better outcomes? Initially, the early data was no, it didn't. And that was probably because surgeons were still learning how to use the robot. But now that those of us who are doing high volume robotic surgery have actually looked at our data, yes, we are seeing improvements in patient outcomes. In our own practice, our laparoscopic outcomes, our complications, were generally about half of what you would expect for national averages. Now we've reduced that by another 50% with robotic surgery. Now, part of that may be a function of experience, but I think without question, when I can see things in 3 dimensions, when I have a camera that is stable, and I can use wristed instruments, and I have a computer between me and the patient, our patients are doing better.